Dr. Kullar, we talk about doctors overprescribing antibiotics. We also talk about patients getting antibiotics when they, in fact, need them and not finishing the full course. Are these two situations contributing to the problem?
They definitely are. First of all, your first point, there being an overuse of antibiotics. In just the US alone, there were 270 million courses of antibiotics that were prescribed in just the outpatient setting, with about 1/3 of these being inappropriate. Your second point, yeah, you need to finish your course of antibiotics. You need to make sure that you don't share your antibiotics with anyone else.
I do want to clarify for everyone, Dr. Clark, because I don't want everyone being fearful when they go hop on a bus tonight or an airplane or go to work. A lot of the transmission of these bacteria, it's occurring in hospital type settings. Is that fair to say? Because obviously, if we get to a place where these drug-resistant superbugs are transmitted everywhere in society, I mean, we really could have the apocalypse and wipes out, and I'm not exaggerating, millions and millions of people. How do we strike a balance right now between avoiding infections, being cognizant when we're out in public?
I think that we need to give our bodies a lot more credit where it's due. Our body is very strong, and we don't need to give a drug for everything. And I think we live in a society nowadays that it's a quick fix for everything. So it's okay if maybe you're feeling a little sick and you may have a cold. You don't need to take an antibiotic. You just let your body fight that course.
And I think Dr. Kullar's point is really important for people watching. The reason we preach not overusing antibiotics in unnecessary situations is we need to reserve antibiotics for when they're necessary to fight off these bacterial infections that can be life-threatening or certainly health-threatening. In this country right now, so many antibiotics are uselessly and worthlessly provided to individuals for viral infections. Usually it's an upper respiratory infection like a cold. And what happens is we develop antibiotic resistance, not just to the organisms we're trying to treat, but then these other, what we call superbugs, they're starting to develop more and more because, again, everyone out there, 270 million prescriptions for antibiotics. Think about that. That's pretty much enough for every single person in the country. We are not meant to be taking annual antibiotics. That's just not the way.
Like a vitamin.
Right, it is. These aren't vitamins. These, a week-long course of antibiotics. I have a lot of friends like this who every few weeks they're on an antibiotic. And it's because it's been ingrained in their head that once they get a sniffle, I have to get an antibiotic.
And they don't realize that they can make things worse.
For them and for, quite frankly, society as a whole. So just talk to your doctor. Ask, hey, is this antibiotic necessary? How long do I need to take it for? And just always, always be very cautious. And I would just lastly add, if you have an immune disorder, if you have a compromised immune system, then you really have to be careful with these new superbugs. Dr. Kullar, thank you so much for weighing in on this important topic.